Okay, so I'm going to be doing an NG tube. I'd first start off by coming in and introducing myself and getting the patient's information, the name, date of birth, and checking the medical charts just to make sure that they're in for an NG tube. And then I would close the curtains and shut the door if that was possible. And then I would basically explain the procedure to her. And tell her that it's going to be a little bit uncomfortable at first when I put the tube in, but we're gonna get it all the way down through the back of the throat into the stomach. But by the time we get it into your stomach, it should feel a lot better, a lot more relieving. So now that I have that, I'm gonna do my hand hygiene, and we're gonna then get started. I'm just gonna set up my equipment real fast. So first, start off by putting this here. Oh, we left the sheet. This thing. This would be here. This would be up there. Don't forget. And then I'm gonna set up the other one. Here. Take this out of the bag, just throw it away. Take this out, get my syringe, some napkin, set this off to the side. Now, what am I gonna do? Okay. I'm going to first start off by measuring the tube. I'll do it from the nose to the back of the ear, and then down to the top of the nose, all the way to the xiphoid process, which is all the way down here. And then I would mark it with a piece of tape or a marker, and I've already put a piece of tape on it. So now that we have that, I would then measure, make sure, well okay, so this would actually be put back into the paper while I measure it. It's a little wonky, just to make sure I have. Okay, this would be a little bit straighter. And now, I'm going to start off, going to get my tape ready. Still need. Okay. And now I'm going to do, so before I would touch this, I will now put my gloves on. Wash my hands, put my gloves on. Alright. Get this ready. Before I stick it in, I'm going to ask her which nostril she would prefer, the left or right. We're going to put it in the left nostril. And now we're going to put the tube into the lubricant, about 2 to 4 inches. And I'm going, well, before I did anything, I actually did forget to lift this up a little bit more. Okay. And I would have this down. So I would do this before I started putting all this together. Okay, so now that we have the lubricant on, I'm gonna tell her to put her head back in, and when I put the first couple inches into her nostril, and then when we get close to the back of the throat, I'm gonna now have her head to sit forward for a little bit, and then we have a cup of water right here, and she's gonna take a sip of water, and each time she takes a sip, I'm gonna put it a little bit further down, making sure there's no resistance. If she has any type of gagging or coughing or anything like that, it could be down the wrong tube, and I would just take it out and start again. But once we get all the way down, she's taking sips of water. I do this nice and a little bit slower, but you get all the way up to about where the tape is. And I get the piece of tape. I won't put it. Another thing I forgot, I would also put medicine on the nose before I put this piece of tape on and put the tube in. But I would then put a piece of tape on. I'm gonna not put it on fully. This will only be a little bit temporary right now. A little loosely here. And I'm going to then take, maybe then take my syringe and I stick it in. I would make sure that I'm getting just a little bit of the stomach fluid, and if so, should be good to go. Clamp this, stick it out, spray it in there. I toss this in the garbage, and then I'm gonna wait to save to do that. Now, since everything looks good, I would take this tube. Stick it in. I will fix this piece of tape a little bit nicer, a little bit more secure. I would also take a marker and I would mark it, so just in case it would fall out, then we at least have a marker to put it back in. Turn this on and it starts pumping. I'll take this stuff out. I throw it in the garbage. And before I would throw it in the garbage, I would test the pH of the stomach fluid. And then I would throw it away. Okay. Now that it's done, I believe that's it. I would come back in to take it out. So I'm just gonna for starters, I would put this back on. I give this to her. Okay. And so she went to throw up. There was one other thing I did forget too. I missed looking at this, whatever it's, I'm blanking right now. But what I would do with the pin was I would pin it to her gown. Oh man, I'd pin it to the gown. We don't really have a gown right now. But it would be pinned, it'd be wrapped up around the rubber band, and then it would be pinned to the gown. This would be on loosely, so she would be able to turn her head fully to the left, and to the right and to the left, making sure that there is no kinks. So, now after that is done, we're gonna go back to taking it out. I would take the pin off, I threw on the cup, and now I would practice before I would even take everything out, it's all getting a little messed up right now, but before I would take anything out, I would do my hand hygiene and all that, and then I would put on a separate pair of gloves. So now we're about to take it out. We would stop the pump. We would close this. Disconnect, throw it off to the side. I would take the tape off nice and slowly. Make sure part. And now we're going to roll it out of the nose as quickly but gently as possible. And throw it in here. And then wrap it up and throw it away. I might give her any tissues if she needed any tissues to wipe her nose. And there was one other thing too that I did forget. I did forget to mention, once the tube was in, to do the oral hygiene about 2 to 4 hours, brushing your teeth, things like that, any drinks or anything like that, to make sure that the bacteria is out of her mouth. And that's going to be it. Thank you.